Good evening, everybody. Today we'll be looking at the correlation of fixed orthodontic treatment and the initiation of eating disorders. Several studies performed correlate the effects of fixed orthodontic treatment and the extensive dietary modifications in adolescent patients. The peak incidence of developing an eating disorder is linked to the adolescents commonly receiving orthodontic treatment. Two qualitative studies were performed. Both involved patients aged 11 to 14 undergoing fixed orthodontic treatment. The patients participated in a focus group, one-on-one or semi-structured interviews to explore the dietary issues. Adolescence is a period of psychological issues that may occur. This can include peer acceptance. Many adolescents look towards their peers for acceptance. The patient may be struggling with self-esteem issues. There is also social embarrassment due to their orthodontic appliance, especially if their peers do not also have orthodontic appliances. Adolescence is known as a period of self-discovery. This is a period where patients are going through many changes as it relates to making the transition to adulthood. Due to orthodontic appliances, food choices may be limited for the patients. Foods are restricted to what is safe to consume with an orthodontic appliance. Pain experience, which can limit food consumption to what is comfortable to eat. It may be difficult for a patient to be motivated to eat due to the pain experience. The patient may have a fear of breaking the appliance, knowing the expense it could be to repair or the inconvenience it may be to have the appliance fixed when it is broken. The patient may be limited to consumptions of soft foods, especially after the fixed appliance is placed or adjusted through treatment.
Eating disorder development is common with adolescent patient population. Eating disorders are considered a range of psychological conditions that create unhealthy eating habits. The patient might have a distorted view of body image and an obsessive desire to lose weight. These disorders not only impact the patient's dental health but also their systemic health by creating negative long-term effects. For this reason, it's the dental clinician's responsibility to detect clinical forms of these disorders in order to effectively communicate with these patients. Anorexia nervosa is commonly manifested in adolescents during puberty or in some cases before puberty. This condition involves severe restrictions of food intake, creating significant weight loss in patients. If patients show symptoms of anorexia nervosa, the patient should receive treatment for their condition prior to the placement of orthodontic appliances. Bulimia nervosa is defined as a combination of recurrent binge consumption within a period of time and purgatory behavior as a form of controlling calorie intake. Binge eating as well as bulimia are brought on by the patient's psychological condition and thoughts of body image, which can be directly affected by the application of orthodontic appliances. Self-induced vomiting is a common method of purging. Based on the results of the two qualitative studies, it can be concluded that orthodontic treatment is a risk factor for the development of eating disorders in adolescent patients. This is a period of life where individuals are managing psychological issues. The development of eating disorders correlates with weight and body image concerns frequently observed at this age. Orthodontic treatment restricts the patient's diet due to pain, inability to chew, social embarrassment, fear of breaking the appliance, and dietary instructions given by the orthodontist. The dental team should thoroughly evaluate the patient to determine their risk for the development of eating disorders before orthodontic treatment is placed. This can be done by having the patient screened by a nutritionalist and psychologist prior to treatment. It is the dental team's responsibility to clinically assess the patient for signs of eating disorder development in order to make the appropriate referrals to improve both patient and dental treatment outcomes.